Hi everybody, I am making part 2 of my breastfeeding series of videos. This one is on latching. It's actually going to be a pretty quick video, but it's actually one of the most important parts about breastfeeding because if you don't have a good latch, the baby can't get the milk. So I'm actually not going to be using my little one for this video. It's a little too hard to get the camera to angle in the right way to be able to see the latch. I actually bought something on Etsy. There's a woman who hand makes these little things. It's a breast and this one simulates the baby's mouth. It looks a little silly, but it's an easier way to show you, and like I said in my other videos and on my blog, I do want to become a lactation consultant, so this will be easier for when I don't have an infant to show how to actually do it. I can use these little props. So this one, it's like a puppet. This one's the baby's mouth, and this is the breast. So you can see this breast has the pink areola, and it's a rather large areola for this size breast, but I've heard some people say, you know, you have a good latch if you can't see your areola when they're latched, and that's not completely true. Some women have very small areola and some have very large, so it's more important to talk about which angle the breast should be and how much of the breast should be in the baby's mouth. So in this example, what I do for latching is to make sure that I have enough in the baby's mouth. The baby's mouth should be open pretty wide and when they latch, because if they don't, like you can see right here, if it's just kind of closed, they'll just barely get the nipple in there, and then they'll only be latching onto the nipple, which is what causes the cracked sore nipples. It causes babies to be very frustrated because it's coming out, the milk is coming out very slow because they're not activating the ducts, they're only activating the nipple. So it comes out very slow, only a little bit comes out, and they're not going to be getting enough. So some women you might hear, oh, you know, I'm nursing and the baby's still hungry, I don't think it's getting enough. You know, that could be it could be a latch issue. So what I do is, for my daughter, I use my breast to get it into her mouth opposed to getting the mouth onto the breast. So what I do, take your breast in your hand if you want to angle it. Once they get a little older, they can just go right in and get it without your help, but when they're little, they need a little help because of course they have never done this before. You want to kind of push the nipple against their bottom lip to get their bottom part of their mouth down. And then once you have that, you kind of turn your breast upward to get the top of their mouth to open. So that way the nipple is kind of towards the roof of their mouth. And that way they have their whole mouth open, and then they can close. So you can see, you can't even see the areola, but there's still some out on the side. So the main part is that their mouth is open and it has part of the areola in their mouth. So that way it activates the milk ducts in the areola. Also, you want to make sure that their chin, which let's call this the chin of this little puppet, their chin is flat against your breast, and their nose, which would be right here, that can either be away from it or just the very tip can touch your breast. I know some women who are a little bit larger, they get a little nervous that you're going to smother them. You won't. If they really are having trouble breathing, because babies are nose breathers, they will unlatch. Which brings me to unlatching. Once they have a good latch, they're pretty much on there. You know, when they're ready, they'll let go, but sometimes they end up falling asleep or they use you as a pacifier and they have that suction as hard as they can, and you don't want to just pull your breast out. You're going to hurt yourself and the baby. And if you've ever stuck, you know, like your finger in their mouth to feel around in their mouth and they latch onto your finger and they start sucking, you know how hard they're sucking. So you do not want to do that to either of you. What you want to do is stick your finger in the corner of their mouth and kind of break the seal just enough to where air can come out, kind of like they create an air pocket, and that will be enough to have them let go. You don't want to pull, because again, it will hurt them. That's all it takes is a little bit, you know, just get your finger right in the corner of their mouth, pull down a little bit very gently, just enough to kind of break the seal, and then you can pull it out. The reason that you would want to do this is if they have started just using you as a pacifier and you need to get up for whatever reason. If you want to use them, let them use you as a pacifier, that's completely up to you. I don't recommend it, especially for long term, but you know, if they're really irritated and they're using you for comfort, that's completely fine. But if you need to get up or go to sleep, or you know your other kids are running around, and you have to get up for whatever reason, or you're in the middle of feeding them and you need to, for whatever reason, do something, that is the way to unlatch them. Also, they could have the opposite problem. You're trying to get them to eat because let's say they're only a few days old and it's been 3 hours since they ate. You'll probably want them to eat. But sometimes babies, when they're that little, they have a hard time staying awake even to eat. So you can actually sort of nurse your baby while they're asleep, but you have to get them awake enough to latch. That's the hard part. So a few little tricks. You can tickle their feet. You can undress them, because if they're nice and warm and cozy and they're swaddled, they're going to stay nice and cozy and want to sleep. So take the blanket off, undress them a little bit. If it's cold in the room, what you can do is, you know, have your clothes up a little bit so that way they're skin to skin, so they do stay warm, and then you can put a blanket over them, but just enough to wake them up just a little bit to get them to latch is what you're really looking for. So those are the main points of the latching video. I know it's kind of hard to see without seeing a baby, but unless you were sitting here next to me, it would be hard to show you. So if you do have any specific questions about the latch, as far as the positioning of the baby and everything like that, please write it in the comments and I will try to answer you as best as I can. And please subscribe to my channel so you can see the rest of my breastfeeding videos and my other videos. And pretty soon I'm going to be making, hopefully pretty much right after I'm done with this video, I'm going to be making part 3 of my breastfeeding series, which is how to pump. So I will see you soon. Thanks guys.